Hello, everyone. You're about to listen to a podcast surrounding pharmacy, prescription drugs, medications, and everything in between. The name of our podcast is the Ask Southern Star Show. On the show, you will hear pharmacists and staff members at Southern Star Pharmacy answer pharmacy and health-related questions. Enjoy the show.
My name is Syeda Ahmed. I'm a pharmacist. I am at Southern Star Pharmacy, director of pharmacy here, and I manage 2 to 3 different pharmacists under myself. Pharmacy is supposed to be about talking to patients. You want to go to the person who knows about that specific area the most. I had a patient once come to the pharmacy, and this is when I realized, oh my God, I'm making a difference.
Why is a pharmacist important to my overall health?
A pharmacist is part of a chain of caregivers. So you don't want to just have just a doctor. Who else is going to manage your medications? Is the way you want to do your health overall is you want to go to the person who knows about that specific area the most. So you're not going to go to a dentist and talk to them about medicine, right? Or you're not going to go to a podiatrist and talk to them about your brain issues. You want to, every person that goes to school for medicine, they have maybe 1 or 2 courses on pharmacology. The rest of it is more on diagnosis and health conditions. Our pharmacists' majority of their education is based on medications. So they have a lot more insight into how medications interact. They've had a lot more years of experience in it, and they can make a lot better decisions and suggest it to healthcare providers as well, something they might have overlooked or something they think might be a benefit to the patient. So for your overall health, in this day and age, prescribers don't have that much time to talk to you. That's just the reality of it. Your pharmacist is your easy access to healthcare. You can talk to a pharmacist one-on-one. There's no white coat anxiety. The level of interaction is there where you feel more comfortable. You don't have to make an appointment. You can walk in and they will sit down and they will go through every single one of your medications. Maybe something that was missed at the office because the visit was rushed. That's something where you don't have to only see that provider once a month or once a year or whenever, every 6 months. You can go in there every week if you want until you understand how to take your medications. And a lot of times the pharmacist will recognize things that are missing, medications that are missing, or even if you're taking your medication incorrectly. I had a patient once come to the pharmacy, and this is when I realized, oh my God, I'm making a difference. They came to the pharmacy, and every time she was filling a prescription, it was for her diabetic medication, metformin. Her doctor kept on increasing her strength of the medication, but her diabetes was not being controlled. So I had a little conversation with her, and I just asked her, I was like, hey, what's going on? And she told me, she's like, well, the reason I'm not taking the medication is because it causes me stomach problems. And I said, okay, are you telling this to your doctor? And she was too embarrassed to tell her doctor that she wasn't taking it. So the doctor didn't wonder if she was taking it or not. He just figured the medication wasn't working. So he just kept on increasing her dose, which wasn't helping the problem because, if she's not taking it, you can give her 3 times the dose. It's still not going to work. It doesn't go in her body. So we just had like a 5-minute conversation. I identified it. I said, hey, there's an easy fix to it. We can switch this medication to the extended release version. It doesn't have as many side effects. You don't have to take it as many times a day. And she didn't even know that happened. The doctor, when I called, had absolutely no idea the patient was not taking the medication. He just assumed it wasn't strong enough. So every time he gave her a higher strength, it made her stomach even more upset. So it was very counterproductive until I jumped in. And that's the job that every pharmacist does on a daily basis. That kind of goes unnoticed.
What if medications make me too sleepy?
So there are certain medications that are going to make you sleepy, right? Medications are not a one fit for all, and people don't realize that. Your body mass matters. So how much of your body mass, do you have? If you're a very skinny person, you're on the same dose as somebody who's maybe overweight or obese, they're going to have a different reaction to it. If your medication does make you sleepy, some do have side effects of daytime drowsiness. Well, we need to address that, right? Maybe there's an extended release version out there. You're not going to know that until you voice those concerns. Your doctor's not going to know that either. So now you've just compromised daytime function. And you're either you're not functioning as well, or you're not taking the medication and that's not helping you either. So it's a lose-lose situation. That's where your pharmacist will jump in as long as you communicate that So what we will do is, what you want to do is maybe they'll suggest you, hey, rather than take it in the morning, take it at night. That'll help you sleep through it. So it'll actually help you. So rather than you sleeping through the morning, it actually helps you kind of fall asleep. And in this day and age, I know I don't sleep. So it's always a great thing.
How does age increase the risk for medication side effects?
Age increases risk because a lot of these medications have dizziness and drowsiness. Now, your gait is not as great when you're a little bit older anyway. Your bones are a lot more brittle. We don't eat the healthiest. We're not really taking care of ourselves. We're not hunter and gatherers anymore. We eat processed foods all day. Sugar is our main diet. So any medication that you take, as your age gets higher, it increases the risk of falls, of fractures. You want to be cognizant of that. The other thing that it might increase is as you get older, your immune system drops. So your body isn't able to fight things off as quickly. And you just have more disease states as you're older, right? And you have more things you're taking that can interact with it. So your age does have a definite contribution to that. And that's something that your pharmacist will be looking at anytime they're dispensing medication, or they should be looking at.
Why do some medications affect my bathroom habits?
That's a great question. Medications in general can cause constipation. There's a lot of medications will affect, you have to have increased fiber in your diet. When we're taking medications, we're not realizing. So antibiotics, patients will take it and not realize that you have to take it with a full stomach. Now, obviously, when you're sick, you don't feel like eating. But even some crackers or carbohydrates would help. If you take it without that, you're going to have diarrhea all day, which is only going to make you feel worse. You're going to have nausea. These are side effects that come with medications regardless. There's no way to eliminate them. They don't happen to everyone, about 10% of the population. However, there is a way to reduce that. Now, there's certain other medication for pain that you're taking, and now you have constipation. So there's always adjunct things that you can do with those. You just have to be aware that, hey, if this is not normal to me and it started with this medication, how can I resolve it? The answer sometimes might be to change the medication altogether. A lot of times you have to weigh the risk versus benefits. Maybe we just need to add a, stool softener because it's making you constipated. Maybe we just add some more fiber. But you have to be careful with that. You can't make those decisions by yourself because certain medications interact with stuff like this. So you have to make sure what you're doing is the right thing. And Googling it is never a good idea.
Does it really matter what time of day you take medications?
It does. Not all of them, but some of them do. So a medication like Singular, which is for it's for allergies, or a medication like Lipitor, which is for your cholesterol. Those medications are preferred to take at night. So Lipitor is for your cholesterol. If you take it at night, the reason that's the case is because it works better at night because it targets a specific fat in your body and your liver produces more of it at night. So that's when it's going to control it better. You can take it during the day, but you might just need to be on a little bit higher of a dose. So why risk that? So yes, it does matter. But obviously if it comes between or certain medications like for, antacid, or you want to take it half an hour before breakfast because you want it to be preventative. You don't want to treat it after you get acidity. You want to make sure that it doesn't happen, right? That's the whole point of it. Patients don't realize that they'll take their Prilosec in the middle of the day or at night and then wonder why they've had heartburn all day. This medication's not working. So it's a lot of miscommunication and of what the medication should be. And until you know how to take it correctly, it might not work for you, and then you might not want to ever be on that medication. You might just suffer, and that's not what the goal is. So we want to make sure, now, if obviously you work at night or something like that, that's a different situation. We can cater it to every single patient, but the ideal thing to do is to follow the directions the way they're stated. But if it comes between you not taking the medication at all, or you taking it at a different time, then, pick the better of the two evils.
How can caregivers help manage medications?
Caregivers, the day and age we're in right now, it's a little bit complicated. Nobody has time. Everybody is busy. We have too many people that are sick, too many people that have issues. And caregivers are just not reimbursed enough for them to give, even if they wanted to, they still have to, run a practice and survive and put food on the table. So that's why collaborative care is huge in this day and age. Maybe back in the day, you had the 2 hours to sit down with a prescriber. You don't have that anymore. So it has to be a collaborative effort. Caregivers nowadays are talking to each other more. And that way it gives them a better idea of how to deal with the patient. So you went to the doctor's office, you discussed 25% of the issues that you had. Maybe you forgot some. It's not easy for you to turn back around and go talk to the doctor. He's already in a different room. So then you come to the pharmacy, you pick up your prescription, you have a pharmacist there. Maybe they're busy. Maybe that's something you can have a conversation on the phone. Or maybe you can just go talk to them about the other part. Now, say it's something that comes up as a concern that you should have talked to your doctor about. It's easier for the pharmacist to get in touch with the doctor and say, hey, listen, we had this discussion. We identified these issues. Let's address this, versus you trying to make another appointment, trying to go in there. So caregivers in general will help manage medications and healthcare conditions, because as a pharmacist, there's a new thing called medication therapy management that insurance companies are paying for now. And they realize the value of it. And the value of it is if you're on your medications correctly, if you're taking them correctly, if there's no interactions. A lot of these patients end up in the hospital because they're going to urgent care, they're going to a primary doctor, they're going to 3 to 4 doctors, and they don't share their information with each other. So you might get one medication from this doctor, another one that might either be the same thing or interact with each other. And now you end up in the emergency room. And they don't realize this until you go to the ER. At this point, it's too late. So the way pharmacies are working, and that's why we discourage polypharmacy, which means going to multiple pharmacies, but encourage to go to one specific pharmacy with all your medications, is even if you visit multiple different doctors, which might be the case, as a mother, I know that if I need to go to urgent care, I'm going to go to an urgent care. I can't wait the weekend to go take my kids on a Monday to a doctor. But as long as I bring that to one pharmacy, that pharmacist has eyes on all your prescribers, all the medications you're on. They will do an interaction check across all of those medications and prescribers. Once they have that, they can make a determination if you're safe, if maybe you're in danger, if maybe you're overdosed, or if there's something that's missing. A lot of diabetic patients don't realize that when they are diabetic, they should be on a kidney protectant, and doctors don't put them on it. And that's only preventative. But that's something that a pharmacist catches, and they call the doctor and say, I really think you should put this patient on it, because eventually they're gonna end up in end-stage renal disease, and we want to make sure that we prevent that as much as possible.
How long can medicine be used after the expiration date?
I don't like to talk about this other than to my own family and friends, but I can tell you, I guess not off record, but there is a date that's mandated by law that they have to put the medication, the expiration date on it. Does it stop working after that? No, it doesn't go from 100 to 0 day 2. So if something expires on the 31st, it's not going to all of a sudden be completely useless on the 1st of the following month. The way the dates are put on the medications, it's on shelf life. So they're saying that on the 31st, it's still going to have 100% shelf life. And then starting the 1st, it's going to start going down. So now it might be 99% effective, 98% effective, depending on how the storage conditions of that medication are and whatever the manufacturer specifications are. So this is what I say. Hey, if it's a headache, take the medication. If it doesn't work, throw it out in the garbage, because now at this point it's not working. But if it's something like an antibiotic, go to a doctor and get a new one. Don't risk it. So it depends on really if it's something where you're, trying to treat nausea or something like that, you can take it. If it doesn't work, it's not going to kill you. Expired medication does not mean poison. It just means it's useless and it might not work, but it can. So in my household, if it's a cough or something like that, I'll give a medication up to 6 months after the expiration. I'll give it to my kids. We'll take it if it works. But if it's something where it's like steroid, or if it, to open up the lungs, it's a breathing medication. If it's an antibiotic, we're getting a new prescription. I'm not going to risk that, right? Because the risk over there is way too high. It's something that needs to be treated immediately. So you need to really differentiate between those.
How should medicines be stored?
So normally they should be stored at room temperature. The way you see them at the pharmacy is how you should be storing them. Do not put them near a heater. Do not put them in direct sunlight. Do not put them where, you have this one vent in the house where that one room is super, super hot all the time because it's directly under a heater. You want to, if it's refrigerated, then obviously make sure that it's refrigerated. Don't put it in the refrigerator just because it's an antibiotic and you assume it's refrigerated. Read the instructions. Not every antibiotic needs to go in the refrigerator. So you have to just follow the manufacturer instructions, but the pharmacist will normally put something on there to let you know. If they put nothing on it, it should be at room temperature. And it can't be too hot or too cold because it is going to affect its stability.
I've heard some foods interact with medications. Which ones do this?
Oh God, that's a long list. We're going to need a couple of days. Yeah. Every medication interacts with something. I mean, it might not be not every medication might interact with every food, but sometimes you say, hey, greens are good for you. Yet not when you're on warfarin, they're not, So depends on the medication. Warfarin, like blood thinners, they have interactions with certain, anything that has vitamin K in it. So that's a lot of your green vegetables and things like that. Lipitor is going to have an effect. And a lot of medications have the same effect, and it's with the grapefruit juice because it has the P450 in it. So grapefruit juice is going to interact with Lipitor. So it really depends. There's a lot of foods that are going to affect with it, interact with the medication that affects their absorption. So it either makes them too high dose or too low of a dose. And that's when it becomes really tricky because when you're talking about something like a blood thinner and it's too high dose, you're going to bleed to death. Or if it's too low dose, you're just going to clot away. So it doesn't mean you can't have food. It means you need to be very honest with your prescriber so they make sure that they're adjusting the dose. A lot of times it's just about dose adjustment to make sure if you are going to do this, if you are going to take that medication and this is part of your daily diet, then we want to make sure you make that adjustment. If it's something you do once in a while, then maybe just stay away from it.
What vaccinations are important for seniors?
So after the age of 65, your flu vaccination is always something you need to do yearly. After the age of 65, you have to understand that your immune system drops by a lot. You're basically back to being a baby. So the two people that come in the same category when it comes to vaccinations after a certain age is a baby that was born and then an older person that's over 65. So it's kind of interesting the way life works, right? You start and you end up exactly where you started. So with that said, anything that affects your immune system is going to be important for seniors. Now, your tetanus shot and things like that, you got to get every 10 years regardless. But pneumonia is huge for seniors, and shingles. So those are the two vaccines that the minute, you turn 65, that's something you want to get. You need to get 2 series of pneumonia. You definitely need to get your flu shot every year because at this point, you can't afford to go to the hospital. You're not coming back out alive, most likely. And then for shingles, if you haven't been stressed out enough already, after the age of 50, it's a much higher. We all have the virus. Well, most of us do. Anyway, any baby boomer does for sure. Now I know there's vaccines for chicken pox, so you might not have the virus, but all of us have had chicken pox, which means we all have the virus in our body. At some point when your body gets stressed or you get stressed, which means that you can get mentally stressed, your body can get physically stressed, or you could be traveling and now you're not sleeping, or if somebody's around you. These are all secondary infections. So the minute you get a primary infection, they creep in and it's going to be all blowout shingles. And anybody who's had it knows it's pretty bad. So shingles vaccine is huge. It doesn't mean 100% you're never going to get shingles, but it does prevent it, or it will reduce the severity of it highly. And then pneumonia is huge. You want to make sure you're getting the 2 vaccines for pneumonia and then a yearly shot of flu.
Hey everyone. Thank you for making it through the entire episode of the Ask Southern Star show. If you would like to have a question answered on our show, please tweet us your question at Southern Star RX. If you haven't subscribed to our podcast, please subscribe and leave us a rating if we brought you any value. Thank you for listening, and see you next time.